But before we begin, a nice quote from Derek Shepherd. It's a beautiful day to save lives. Alright, people, let's do a brief analysis of what's going to go on today while our patient is getting the remainder of the anesthesia to fall asleep. What we think we are working with today is actually a collapsed lung over here on the side, and possibly a bunch of fluid in the lung as well. So what we're going to do is go ahead and make an incision, insert a chest tube, and see if we can remove any either foreign bodies or just fluid that is, again, in the lungs, where it should not be because it has put this person into pulmonary distress. So let's go ahead and get started. This is long-acting anesthesia, so I'm going to go ahead and remove the mask, the nasal cannula mask, and we'll just set that to the side for now. The anesthesiologist will take care of the rest. This patient will not wake up, don't worry. So let's first get our patient prepped for the incision. And I'm just taking a sterile alcohol swab. And I'm going to rotate slightly on the side here so we can access the lungs, or the lung. It's going to be about right here. So let's go ahead and clean off really good. Okay. That should be good. Make sure we're really clean, especially because we are inserting that tube from the exterior into the lung, and we don't want to bring in any germs or cross-contaminate at all. Oops, stay there, buddy. Alright. Now what I'm going to do is take my scalpel, and we're just going to dive right in here with our incision. Let's see. We are going to go across right here. You see all of that fluid that's coming out of the chest wall already. That lets us know that there is definitely some fluid in the chest. I'll take this explorer now. Go ahead and just feel around. Okay. I think we are going to have to make this incision a little bit bigger than expected, so I'm going to go ahead and make it just slightly wider because we do have to put the chest tube in. Let's see how this is. Okay. Let's go ahead and take a look. Ooh, yeah. Ooh. Okay. So, as you can see, we have a lot going on in this lung. Let's get... Alright, this one I'm gonna do. Let's go ahead and get one of these for a sample. See the texture. Oh, okay. It's very gelatinous, as you can probably tell. We'll take both, if possible. There we go. Alright, we'll send those off to get tested. let's go ahead and irrigate just a bit with some sodium chloride. Oops, our patient is on the run. Okay, I'm just gonna add in an extra layer here underneath, as I'm assuming this will be messy. So let's open up this incision a bit. Stick that down and just irrigate. Okay. Looks like we got a pretty clean open hole here. I'm gonna go ahead and insert the chest tube. And also, the chest tube is going to have this connected to it so that we can pull out any of the fluid, or we will try to anyway. We will see how it goes. So let's go ahead and insert this now. There we go. Lots of pressure to get that in. Now I'm going to attempt to suction anything out, so I'm going to pull now on the syringe here. And as you can see, it doesn't look like anything wants to come out. So what that means is we are going to have to just allow this tube to stay in. Oops. I'm going to allow the tube to stay in so that it can drain as needed. Let's try one more time here. Yeah, nothing there. Okay, so now we have to go to plan B, which is going to be, let's disconnect this. And what we will do is slightly elongate this incision mark, ever so slightly, not too much. And I'm going to attempt to suction with just the plain syringe. Oop. And this is what we're getting, which leads me to believe there is an infection somewhere inside here. This is what is coming out of the chest cavity. That's not good. Let's see if we can get any more of that out, and we will leave this patient. We're going to definitely have to start some antibiotics. I'm going to do an antibiotic rinse inside of the chest wall. And what I'll also do, let's check this chest tube. Okay, still seems pretty clear. Okay, yeah, there's still a lot of green pus in here. So we'll insert this tube again. I'm gonna see if I can dig around a bit and remove any more of those nasty clumps of infection. Ooh, look at that. Yeah, this is badly infected. Badly. Yeah, nurse, can you please get me I guess 5 milliliters of the antibiotic wash? Okay, thank you. Oh, wow. As you can see, the more that we press, the more infection that comes out. So that leads me to believe that there is probably quite a bit in there. And that also leads me to believe that this patient must have been struggling to breathe for quite some time, if I had to guess. Alright, got that wash? Okay, thank you. I'm gonna dig around just a bit more before we put in that antibiotic wash. Okay. Oh man. Just look at what's coming out. This is crazy. Look at that. Wow. I don't think I've ever seen anything like this. Wow. I am just appalled. Oops. Patient's trying to get away here. You stay there. Alright, so had to lay down some new bedding here because, as you can tell, the fluid is actually coming up the chest tube now. Look at that. The fluid is completely green in there. Not good. And just look how much is coming out. Oh man, what a mess. What a mess. This poor person. Alright, I'm gonna go ahead and irrigate with this antibiotic rinse here. Okay. And that's going to help clean everything out in here, so that hopefully it doesn't look like this when the patient wakes up with so much fluid. And what we'll do is get a bag to attach to this over here, and that will drain the chest tube continually like this. And then hopefully this person will be feeling much better. Let's go ahead and get a clean area really quick so I can go ahead and pack this incision. So give me 1 second here. That looks pretty good. I'm going to take this sterile gauze dressing pads, peel that open. I'll have to cut this slightly smaller. And let's go ahead and push this down in. Just like that. And we will do one more piece so that we can really hold this chest tube in and make sure that nothing outside gets in there as well. I'm hoping that those antibiotics will help clear this chest up really quickly, because right now it's not looking great. This is a really bad infection. And let's go ahead and lay some pieces of this around the tube. Like that. Alright. That's going to be it for today. This patient will be monitored very closely to hopefully make a full recovery. I think we did what we could for today's surgery. And let's just send some positive vibes for this patient so that they heal and make it through the rest of the year. Alright. Thanks for tuning in, and I will see you in the next surgery.